being here or for tuning in wherever you might be. I am joined again today by Dr. Joe Cantrell. He's going to go over some of the gating criteria slides with you in just a moment. But I can summarize the information that you're going to see, and it's going to show that we're currently moving in the right direction and have been for several weeks now. And certainly we're all gratified by that. All of the gating criteria that we typically look at, percent positivity, cases and hospitalizations, are much better than they were, for example, on January the 8th, which was the worst point in any surge thus far in Louisiana. For example, you're going to see that the percent positivity today is about 5%. That's about a third of what it was then. Hospitalizations, about a third as well. Case growth is down. Deaths are down, but still way too high. But we are doing better, and that doesn't just happen. It happens because people make a concerted, conscious effort to change their behavior and not do the things that caused the surge to begin with. And make sure that they follow the restrictions and mitigation measures. And so I want to thank everybody for that. We know, however, we still have a lot of work to do before we get out of this pandemic. But for the reasons that I just announced, we are announcing today that pursuant to a proclamation that I signed a few minutes ago that's effective tomorrow, we're going to be moving to phase 3, and it will look much like the previous phase 3 that we were in the early part of the fall. There may be some differences, and I'll go through some of that information with you all in just a moment. So the current order expires tomorrow, and the proclamation I signed a few minutes ago will go into effect then. It will remain in effect for 28 days, will not expire until March the 31st. And I do want to pause here and say that there are some reasons to be concerned. First of all, the nation appears to have plateaued, so that most places in the country have been doing better for several weeks, and in terms of cases and in terms of positivity and deaths and so forth, that appears to have plateaued. But we also know that there are multiple variants out and about across the country, including here in Louisiana. Principally, the one that we've detected most frequently is the UK variant, which is more easily transmitted, and it also, pursuant to at least some data that we have, it's more likely to lead to worse outcomes, meaning serious COVID hospitalization and death. And we know that that's happening here in Louisiana with that variant. And so for those reasons, the mask mandate will stay in place, because as you ease restrictions on occupancy, for example, and you bring more people into a venue, it is more important than ever that you wear a mask as a way to not increase transmission of the virus, and cases of the disease don't increase as well. So the mask mandate is going to stay in place. So the phase 3 order will look like this, and of course the proclamation itself is going to have more specific information. The majority of businesses, including restaurants and salons, will now be able to move to 75% of their capacity, and indoor gatherings and event centers will be capped at 50% of their capacity and limited to 250 people. Social distancing, masking will be required at all times, except when eating and drinking in those places. Religious services will not have capacity limits on them going forward. Again, the mask mandate remains in place. And social distancing, meaning 6 feet between people who are not in the same household, is still strongly encouraged. And we are especially asking that everyone be mindful of those who are more vulnerable to the disease because of their age or comorbid health condition. But there will not be a capacity limit affixed to places of worship in the next proclamation. Gyms and fitness centers will remain at 50% of their capacity, and that's based on recent research from the CDC that raises concern about the spread of COVID-19 in these settings. Bars in all parishes will be able to open for indoor service at 25% of their capacity. However, 50% of capacity will be allowed in parishes where the percent positivity is less than 5% over 2 weeks. Alcohol sales must still end at 11 p.m. Nobody younger than 21 can enter a bar, and patrons must be masked at all times except when eating or drinking, and they have to be seated at tables that are properly spaced out. I do want to remind everybody that outdoors remains far safer than indoors for any activity, and as we get into the spring and the weather becomes better, certainly we would hope that individuals and businesses would take advantage of this and have as many of these activities take place outdoors as possible. Additionally, live music will be allowed indoors under additional guidance that's provided by the State Fire Marshal. There is an extensive set of guidelines available on opensafely.la.gov. That's opensafely.la.gov, the same website we've been using all along, but it directs businesses on how to bring music back safely, and the Fire Marshal is going to focus on things like air quality, the HVAC system, the distance between the performers and the audience, and potentially using barriers between those two. I think it goes without saying, but all audiences of indoor live music have to be seated at all times. Indoor meetings and event venues may operate at 50% of their capacity up to a cap of 250 people, and those indoors events must be seated. Outdoor events may operate at 50% of their capacity with no cap on attendance, but will be required to have 6 feet of distancing. Conventions, conferences, indoor sporting events, fairs, festivals may operate up to 50% of their capacity. Again, there will be distancing requirements, but they have to submit a plan that gets approved by the Fire Marshal, and of course the Fire Marshal acts in consultation with the Louisiana Department of Health. The new order will expire in 28 days, as I mentioned before, on March the 31st. And while we're doing better and while we're easing restrictions, no one should think that we're out of the woods. And the mitigation measures remain important. And if we're going to keep moving in the right direction, especially with the emergence of the variant, which is still predicted by many to be the predominant strain of the virus circulating in the country and in the state of Louisiana at some point this month, in the month of March. So wear your mask, practice social distancing, wash your hands frequently, get tested if you've been exposed or if you feel ill, and if you feel ill, make sure that you stay home, and then get the vaccine when it's your turn. And in fact, more important than ever, it's more important than ever to do these things, as I mentioned before, because of the UK variant here in Louisiana. This is how we keep our numbers headed in the right direction, and we minimize the number of people who have to be hospitalized and those who die. Speaking of the numbers, today we are reporting 770 new cases on 26,190 new tests. We have gone over the 6 million mark in tests performed over the course of this pandemic. And so that's basically about 11 months, 6 million tests over the last 11 months. Other big numbers, 431,000 confirmed cases in Louisiana, and we're just shy of 10,000 deaths at this point. Today, we are reporting, sadly, 19 additional deaths. Not since March the 22nd of last year have we reported 0 deaths. I am eagerly looking forward to that day, and I hope that day comes as soon as possible, that we can report 0 deaths here in Louisiana. 629 patients are hospitalized across the state of Louisiana with COVID-19. That's the same as yesterday. 89 patients in these hospitals are on mechanical ventilators, and that's down 2 from yesterday. Yesterday, we reached the milestone of surpassing 1 million shots in arms of the vaccine. That's exciting. We know that we don't put this pandemic behind us until enough people have been vaccinated. But what that means is more than 14% of our residents have gotten at least the first dose of the vaccine. And that is a good start, but we've got a lot more people out there that we have to reach. Last week, I was able, on Friday afternoon, to stop by a community vaccination clinic that was held at the Living Faith Christian Center in North Baton Rouge, an area where we know that there had been a gap in our administration of the vaccines. They were able to vaccinate 2,198 individuals over 2 days. It was a tremendous success because community partners and providers worked together to identify barriers, remove them, and meet people where they are. We need a lot more of this, and certainly we're going to be moving in that direction. I'm excited also to tell you that later this afternoon I'll get my second dose of the Pfizer vaccine here in Baton Rouge at the Pennington Biomedical Center. I am incredibly thankful for this opportunity. I encourage everyone to be vaccinated as soon as you're in the priority group with whatever vaccine is available to you. And I know there have been some questions with the legislative session coming up soon. We have been working with the Speaker and the President to make a vaccine available to legislators and essential staff who work here in this building before the start of the legislative session. And they are talking to their members presently to get this coordinated. But we know that some legislators would rather have access to the vaccine in their districts so that they can have media appearance events and so forth. And so we are going to add legislators to the current order of priority today so that they can schedule and receive vaccine in their district if they want, or they can take advantage of the opportunity they're going to have to do that here at the Capitol with the event that we're working on with the Speaker and the President. There is also good news to share about the Johnson & Johnson vaccine, a one-shot vaccine that was authorized for emergency use by the Food and Drug Administration over the weekend. And today, the White House announced that there's a partnership between Johnson & Johnson and Merck who will help manufacture this vaccine in order to produce an even greater supply over time. Louisiana's first shipment is on its way. On Sunday night, we were able to put in orders for 37,900 doses. Those doses may have actually started coming in today, but you know they should be coming in very soon. And I think Dr. Canner's got some more information for you, but when I told you last week that typically we get a 3-week visibility and the amount of vaccine that we get in 1 week is the floor of what we can expect for the 2 weeks following that, I told you that was not the case with Johnson & Johnson. And it appears that we may not get more Johnson & Johnson until the very end of the month. And so that's obviously is going to change the way we do things with respect to Johnson & Johnson and having access to large amounts of this single-dose vaccine to have the mass events that we were hoping to have. But we'll be getting with all of our providers and making sure that we, as we always do, that this safe and effective vaccine is put into people's arms as soon as possible. This vaccine offers certain advantages because it is a one-shot vaccine. And so logistically speaking, it's just much easier to administer, especially to certain populations who may be underserved, lacking in transportation, maybe in rural areas or whatever. The other thing that makes it easier is there is no ultra-cold storage requirement. In fact, it doesn't even have to be frozen at all. It can be refrigerated, so that makes it much easier logistically to handle. And very importantly, it's 100% effective at preventing hospitalizations and deaths. At this time, I'm going to ask Dr. Cantor to come up. He will speak to you all, and then he will take whatever questions you might have, and then I'll come back up, finish out my remarks, and then take your questions as well. Thank you.
Thank you, Governor. Good afternoon, everyone, and congratulations on the upcoming second shot. I'm very excited. I'd like to take a couple minutes and talk about the numbers that we've been seeing over the past couple weeks, which I'll just tell you off the bat are, on one hand, encouraging. There's no question about that. We peaked over the Christmas and New Year's time, as did most of the other country. We've been coming down since that time, and that's informing the decision that the governor just announced. On the other hand, I do want to be clear for folks out there, do not equate the relaxed measures with there being zero risk. The governor just said it very clear, we are not out of the woods by any means, and so people need to realize that, as we've been saying very clearly throughout the entirety of this pandemic, there remains risk, there remains reasons for people to be vigilant. The only difference now is we know a lot more about how to keep ourselves safe, how to keep our families safe, and I'll ask people to remember that. Try and go into the next slide, please. What I'm showing here is the typical gating criteria that we look at every time a decision is to be made, and then regular intervals beyond that. We'll convene the health department, other stakeholders in state government, and the governor, and brief out on the numbers that we look at. On the top left, you'll see COVID-like illness. This is a measure of people who present to emergency departments with symptoms suggestive of COVID. It's a proxy for diagnoses. As you can see, we peaked right around New Year's or so and have been coming down very steadily since then. On the top right, you'll see incidence, which is a measure of new diagnosed cases rolled over a 7-day rolling average. Again, you see a very similar trend, a very, very large spike over the Christmas and New Year's time, the highest to date for Louisiana. This was the largest spike that we had, and now coming down, and it's been over 50 days in a downward trend, which is significant. On the bottom left, you'll see two different items being displayed. The orange bars on the bottom are percent positivity. So these are their percent of resulted tests that show positive, and we were at 5%, which is relatively flat for Louisiana, also on the downtrend. The caveat to that is the purple line just above the orange bars, and that's testing volume, the number of tests being conducted per capita. And as we talked about last week, we have to look with this data a little bit nuanced because the winter storm 2 weeks ago caused a disruption in our testing. We did less testing as a result. People couldn't travel. The National Guard was helping with storm activities. There were a number of reasons why testing was down. So when your testing is down, it's a little bit like you have less visibility. And so I mentioned that as somewhat of a caveat, and that's why you see the dip in that purple line on the bottom left graph. And then importantly, on the bottom right, you'll see a graph of hospitalizations. These are the number of COVID-positive individuals in inpatient hospital settings throughout the state. You can very clearly on that graph see the three spikes that we had. The first spike in March and April, the second spike of the summer surge in July and August, and then the third spike in Christmas and New Year's time, again going down very, very steadily. We're at just above 600 people hospitalized and COVID positive right now across the state. We've never gotten below 500 since it's really started for us, and we're trying hard to get there. But that's where we are now. So when you look at the measures, next slide, please, we are in a much better spot than we were, let's say, around December or November when cases were going up substantially. Next slide after that, please. Great. What I want to say to that is a couple points. Despite numbers going in the right direction and despite feeling like the state is an appropriate place to relax mitigation measures, the risk to individuals still remains. There is still COVID being transmitted every day. What we do know now is we know what works. We know how to prevent transmission, and we know that very well. It's masking, it's distancing, it's washing hands, it's avoiding indoor spaces where that is possible. None of that changes today. Those are just as important, perhaps more important, and I'll come back to that in a couple of minutes. I do want to pause there and let me talk a little bit about the Johnson & Johnson vaccine, which continues to give me great excitement. This is just a tremendous advance in our fight against COVID. I could not be more excited about this. On Friday of last week, what's called the VRBPAC committee, or the Vaccines and Related Biological Product Advisory Committee of the FDA, meted and voted unanimously to recommend to the head of the FDA that the Johnson & Johnson or Janssen vaccine receive emergency use authorization. Head of the FDA granted that authorization on Saturday. On Sunday, the CDC's Advisory Committee on Immunization Practices voted to talk about more granular recommendations on the Johnson & Johnson vaccine, and they voted unanimously to recommend to the head of the CDC, Dr. Rochelle Walensky, that the CDC endorse the Johnson & Johnson vaccine for everyone 18 years of age and older, and that's what Dr. Walensky with the CDC did. So we now have two evidence-based bodies comprised of independent experts unanimously recommending the use of this vaccine. Let me tell you a couple other reasons why this vaccine makes me so excited. I know we talked a little bit about this last week. It is an incredibly well-studied vaccine. So again, this is a very, very large trial. In fact, the trial that supported the Johnson & Johnson application to the FDA was the largest vaccine trial to date, over 40,000 individuals. And importantly, not just in the US. It covered Latin America, particularly Brazil, which is of importance because there's a variant we're watching there, and it covered South Africa as well. So a very, very, very large trial, and a very diverse trial, a very, very diverse trial. So of all of those study participants, 17% self-identified as Black, 45% self-identified as Hispanic. Very, very diverse trial. This is a safe vaccine. It's a safe vaccine across a number of types of individuals. It's also a very effective vaccine. And after 28 days post-vaccination against a single dose, at 28 days after and onwards, not a single person in these trials that got the vaccine died, from COVID. Not a single person in these trials who got the vaccine was hospitalized because of COVID. Not a single person. And that's why we take the vaccine. Again, if all COVID did was give you a mild cold, that would not be why our lives have been disrupted. You know, we've been living in fear for 12 months about the worst complications of COVID, and this vaccine, 28 days after getting a dose, is 100% effective. It's quite effective before that, too. It's very, very effective at 14 days, a little bit more at 28. This is substantial. This is absolutely substantial, and as we talked about last week, this is going to be a game changer in our fight against COVID. There is a little bit of disappointing news in that, and excuse me, this is late breaking for us because we just heard it on a call with the White House coronavirus team a couple hours ago, in that we were hoping and expecting to get some more shipment of J&J vaccine next week, and that's not going to happen. There'll be no shipments directly to the states next week, and likely not the week after that either. So what we were told this morning is that there might not be additional shipments of J&J vaccine until the end of this month. We have our shipment in state now, the 37,900 that we were expecting. Those will be used as quickly as possible. What this means to us is we just have to do that much better of a job at using every vaccine that we have right now as quickly and equitably as possible. And we need to be in a real good position so that when we do get resupplied with J&J, we'll be able to use it as quickly and equitably as possible then too. We've met plenty of challenges before. This is just another small bump in the road, but we'll be ready to meet this one when we do get more supply coming in. I can tell you we are getting a little bit more of the Pfizer vaccine next week. So these are estimated allotments that are visible to us now. They'll be confirmed on Thursday of this week. But I'll tell you what they are right now. For Pfizer, our allotment has gone up a little bit to 57,330. That's just shy of 5,000 more than the week prior. And that is, as we're doing now, accounting for 6 doses of vial at a Pfizer. Our Moderna allotment is going to hold flat at 45,000 doses. So that gives us a total estimated allotment for what will be week 13, the week starting March 7th, of 102,330 doses. And just like we've been doing, we will use those quickly and equitably throughout the state. Taking a step back now, I do want to talk about the variants, and this is one of the reasons why I am so cognizant of couching the talk about our improved numbers with some level of concern. Because as our numbers are going down, as the governor has said, we know the variants are increasing. They're increasing across the country. They're increasing here in Louisiana. So as of now, for the B117 variant, that's the one that was first identified in the UK, there are 18 confirmed cases across the state, an additional 58 that are suspect pending confirmation with the CDC. In all likelihood, all or most at least of those will be positive. They're now covering all regions except regions 3 and 8 in the state. And again, as we've said before, they're likely there too. We just haven't identified it because the country doesn't do a whole lot of genomic sequencing. So the variants are out there. The CDC still thinks they're doubling in number every 10 days. And we still believe at some point in the month of March, this particular variant is going to be the dominant variant in the US. All told, it's in 46 states with over 2,400 confirmed cases, and then a number of other suspect cases pending confirmation. This variant is a threat to us because it's more transmissible, it's likely more virulent, likely makes people sicker as well. So we have to be cognizant of that. I'll let you know at this point, for the South African variant or the B1351 variant, we have not identified that in Louisiana. It has been identified in 16 states across the country, the closest to Louisiana, of which being Texas, Tennessee, Florida, and North and South Carolina. Likewise, we've not identified the P1 or the Brazilian variant either. That's been identified in 5 states, the closest to us being Florida. These variants, particularly the B117, will continue to replicate and continue to increase in transmission. What we hope to do is build up enough of a base of vaccine, enough protected individuals to fight against that variant when the variant's numbers increase. As of right now, we've initiated the vaccine series in about 15% of all Louisianans, 18 or 19% if you just look at Louisianans over the age of 18. That's not insignificant. That's a substantial number. We're going to keep building on that and keep building on that. What we need help from the public with is use this window of opportunity where cases are going down and the variant has yet to really overtake us. Use this window of opportunity to continue to suppress transmission. Because if we can suppress it just a little bit longer, we're going to buy time to have more people vaccinated. Again, we've given over 1 million vaccine doses so far. It's an incredible milestone. If we suppress it a little bit longer, we're going to set ourselves up to weather any potential surge that this variant might bring. But we need people to remain vigilant, do all the things that we know work: masking, distancing, hand washing, staying outdoors as much as you can. Keep vigilant just a little bit longer because we think this is a real window right now to set ourselves up for what might be coming with this variant. With that, I'll be happy to answer any questions if there are any. Yep, Sam?
With the Johnson & Johnson vaccine only coming this week, not again until the end of the month likely, what specific plans does that disrupt? Is that going to put any plans for community vaccination centers on ice? And where exactly are you going to be sending the J&J doses that we got this week? Is that just going to be folded into the normal allocation to pharmacies and other providers?
Not exactly the normal. I mean, the J&J vaccine will go to all 9 regions of the state. There are a number of events that had been planned and been working on plan, and the team right now is working with this late-breaking news to make sure that those events can continue. So we'll get back to you to confirm exactly which events, where, and when, but the events that were being worked on, we're really trying hard to make sure those can continue. You know, obviously, this threw us for a little bit of a curve because we were expecting some vaccine to come the next couple weeks. But without question, it will go to all 9 regions of the state. Melinda.
In terms of the waste numbers, can you provide an update on how many lost doses we've had?
Sure. The total number right now is 972 doses lost, and that's for everything that has been received to us to date. So it's just shy of, I think, around 0.01%, or maybe just a little bit below that. And I'll let you know as well, there's been 2 so far confirmed that were related to the storm a couple weeks ago. Both of them were related to electricity issues, and the refrigeration went out of capacity. And again, the way these processes work is when a provider realizes that vaccine perhaps has gone out of temperature range, if that is the issue, it's not always the issue, but if that is the issue, they'll reach out to us, and LDH, we will involve the manufacturer, whether it's Pfizer, Moderna, or now Johnson & Johnson, and run through what happened. Sometimes the manufacturer will come back and say you can actually continue using it because it didn't go outside of some parameter. Sometimes they say you have to waste it. And that's what happened in those 2. There's a number of other reasons why vaccine would be wasted. Sometimes it's simple human error, like dropping a vial and it cracks, and sometimes vials get damaged in transport. Well, thank you, everyone. Again, have a good day. Mind the weather today, and remember, it's there still is transmission happening. So the message to folks across the state needs to be that we know how to keep people safe, and that needs to be the #1 goal for families right now.
Thank you, Dr. Cantor. And I'm going to wrap up very quickly and take your questions, but I do think that it bears mentioning that the one region of the state where over the last 14 days when we looked at the gating criteria, where you had increasing cases and hospitalizations was in Region 5, which is the Lake Charles area. And that also happens to be the region where we have detected and suspect the most cases of the variant. And in fact, if you add up the confirmed and suspected cases, 1/3 of those are in that Lake Charles region. And we wanted to make sure that people understand that this is a very real threat, and it's one that we need people to be cognizant of. And it's also one that should, I think, lend credence to this notion that we need to do all that we can by masking and so forth to make sure that we prevent that variant from gaining a foothold before we can be vaccinated in the numbers that we need to be to make sure that it can be contained. And that leads to the second point. People need to be vaccinated as soon as they are able, and they need to access whichever vaccine is available to them at the earliest opportunity. So with that, I'm going to take your questions. Yes, sir.
Hi, Governor. I'm sure you guys have heard, but the Archdiocese of New Orleans urged Catholics not to get the Johnson & Johnson vaccine. So I guess 2 questions with that. One, do you guys have a response to that? And 2, is there a way for someone who wanted to choose to get a certain type of vaccine, is there a way for them to, see that, oh, this pharmacy is giving out this vaccine, so I'll go there, or choose which kind of dose they're going to get?
Would you believe me if I told you I hadn't heard about that statement? Now, to get to the second part first, I don't know of any state, and certainly not here in Louisiana, are we giving 2 or more vaccine types to the same provider to be administered at the same time in the same locations. And the reason is there's no way to do that and be a model of efficiency in terms of spreading the vaccine out across the state, making it available to the most number of people, but also trying to make sure that you don't have the wastage that we got the question a while ago, I think, from Melinda. And then each vaccine has to be administered a little differently, and so that's not going to happen. So for the foreseeable future, at least until such point as perhaps the demand doesn't exceed supply, it isn't like you're going to be able to go to a vaccination site and be given a menu and you say, I want the Pfizer, or I want the Moderna, or I want the Johnson & Johnson. So that's just not going to happen for some period of time. We are going to make sure that individuals at the time they schedule their appointments know which type of vaccine is going to be administered at that appointment. That's something that's important to us. Is actually something that came up today on the call with the White House. This morning at 10, we had a call. I think just about every governor in the country was on the call, and we had individuals from the White House COVID task force that was working, that's working this issue, and encouraged all the states to make sure that when people schedule an appointment, they know the type of vaccine that they're going to get. Now, obviously, I have tremendous respect for the Archbishop of New Orleans, and Archbishop Amen and I spoke on Sunday afternoon. And I would point out that I don't read his statement as completely telling people who are Catholic or otherwise not to avail themselves of the Johnson & Johnson vaccine. I would also point out that there was a different statement that came out from Bishop Duca here in Baton Rouge, and he has a little different take on it, and certainly acknowledges that there are some moral concerns for Catholics, and I happen to be one of those, but talks about it a little bit differently in terms of what Catholics can and should do, and I would say that but if for reasonable circumstances you are only able to receive the vaccine from Johnson & Johnson, you should feel free to do so for your safety and for the common good. In addition, I've consulted with Catholic healthcare representatives and understand and appreciate their serious challenges as to the acquisition and equitable distribution of all three vaccines. I therefore support their policy of administering any of the vaccines as circumstances require. So you do have to weigh this with the common good of ending a pandemic. You know, and there's an imperative that we do this. The fastest way to do this is to employ all of the vaccines and have the uptake in those vaccines be as great as possible. And I've also, by the way, looked at documents available from the United States Conference of Catholic Bishops, and I've also consulted the Congregation for the Doctrine of the Faith, which is a Vatican-based source of information. And so I'm encouraging everyone out there to take the first vaccine that is available to them, whether it's Pfizer, whether it's Moderna, or whether it is Johnson & Johnson. Yes, sir.
Governor, the rules you laid out seem to be less restrictive than the previous iteration of phase 3 as it relates to bars. You mentioned Lake Charles seems to be having issues right now, and previously you had to show you were under a certain threshold of percent positivity to opt into the bars. Now bars in Lake Charles can open at 25% regardless. I'm wondering why that decision was made to be less strict on the bar front when, as you know, your administration has said bars are the most risky settings out there.
Well, and they are, which is why they still, in terms of occupancies, are more restrictive than most other venues. And secondly, we're having other rules associated with them. No one under 21, everyone has to be seated, tables and parties have to be distanced, and all of those sorts of things. But I believe that there's been enough progress made and that the reduced positivity is sufficiently spread across the state that we were able to take this step responsibly at this time. So that's why we did it, and I'm very hopeful that the restrictions that do remain in place and the mitigation measures that remain in place will be practiced, and that we will not see an increase in transmission and so forth with these venues. We're obviously going to continue to watch it. We're still engaged in contact tracing, for example, but generally speaking, every day we're looking at the data, and so, you know, again, we're optimistic that we can be successful. And in fact, I know we can be successful with the rules that are going to be in place with the proclamation that's effective tomorrow. It's just a question of the degree to which people comply with those mitigation measures and with the restrictions. Yes, ma'am.
Along the same lines, why did you change your mind on the live music indoors? That's obviously been one of those areas that has not been allowed under any of the previous phases, including when we were in phase 3, I don't think. And so can you walk me through why you changed your position on that?
Yeah, the answer isn't any different than I just gave Sam. We're in a better place, and we believe that it's something that if it's done in accordance with the measures that are going to be required by the fire marshal with respect to the distance between the performers and the seated audience, whether there's a barrier, the type of air circulation you have and so forth, that it's a safe thing to do presently, whereas we could not come to that conclusion before. And I just think that's an inevitable consequence of having improved. And I'm very hopeful that we never have occasion where we have to go backwards, but you all know that we will if at some point it becomes necessary. And I've said we're primarily interested in preserving hospital capacity and saving lives. And I'm very thankful that at no point up to now have we in Louisiana lost the capacity in our hospitals to deliver life-saving care to COVID or to non-COVID patients. And that wasn't, you know, by accident, because we've been severely threatened in the capacity, both with respect to beds and staffing in the past, but we've never gotten there. But if that's the direction we're headed, we will do what is necessary to make sure that we preserve that capacity to deliver life-saving care. So this hopefully is an opportunity for us to move forward, to do it safely. But if we have to go backwards, I mean, we will. It's not something that I want to do, as you all know. But I feel like we've made enough progress to date that this is something that we can do safely with the restrictions and mitigation measures that we talked about. Yes, sir.
What sort of restrictions in place on outdoor venues like the box or baseball parks across Louisiana, and what considerations went into that decision?
50% in distance. Which is an increase from 25% in distance. And in addition to that, and I'm going to give this an answer to your question, and I don't even know whether it happens, because we're opening bars in the parishes, if they sell beer at Alex Box, they can sell beer and be at 50%. Now, I should say alcohol, because it may be more than beer, I'm not sure. But the patrons are going to have to be seated in order to consume. Yes, sir.
What about the PMAC? Are there any talks about expanding LSU basketball? I know there's a cap right now, I guess, of indoors of 250 people. Are you going to work with them on expanding?
No, I believe that the cap on sporting events is going to be 50%, period, without the cap in the maximum number of persons. So it's 50% masked, distanced, and again, they can consume, drink and eat food without their mask on, but they need to put their mask right back on.
And on the bars, 5% is the threshold to get to a percent positivity to get to 50% occupancy. Yeah. Is that a 2-week threshold?
2 weeks. And the next information that we're going to release will be tomorrow. It should be on the LDH website, and so you'll be able to see which parishes qualify. I don't have that number today, but the next one comes out tomorrow, and the proclamation is effective tomorrow. So we'll see.
And on that point, do the local municipalities have to opt in to let
No.
the bars do that?
No. It'll be 50% if they're on the list, unless the parish opts to be more restrictive. So there will not be an opt-in required. Any other questions? Well, I want to thank you all for continuing to cover the COVID situation and everything else that's going on in Louisiana. And I want to, again, convey my appreciation to the people of Louisiana. We are doing better. But I also want to strongly caution people not to take this good news as a reason to let your guard down. Certainly don't take it as a reason to not be vaccinated when the vaccine is available. We only put this pandemic behind us and get back to normal when enough people have been vaccinated. We are in a race against time and against the virus. And so when that vaccine becomes available to you, when you're in the order of priority that is being vaccinated, please make sure that you take advantage of that opportunity just as soon as you can. All of these vaccines are safe and effective. And I'm just going to encourage people to mask, to distance, to wash their hands, to stay home when they're sick. Let's continue to protect the most vulnerable among us by age or comorbid health condition, and let's get vaccinated when we can. And when we do that, we're going to get through this at the soonest possible time and in the best possible shape. So thank you all, and I may be seeing some of you a little later this afternoon when I receive my second dose of the Pfizer vaccine. And again, I am extremely happy about the opportunity to do that. It's something I've been looking forward to for a very long time. And I encourage everybody to get there just as soon as you can. Thank you.
The House. The position at court.